Hi everyone, this is Ayushi Kamboj, health coach at Besugarfit, and today we are going to talk about a very common problem, which is high cholesterol levels. But first, let's understand what is cholesterol. So cholesterol is a waxy fat-like lipid which is produced in your liver naturally. Usually it has a bad reputation, but do you know that it is actually involved in various vital functions, such as production of certain hormones, formation of cell membrane, and even vitamin D. So certain amount of cholesterol is absolutely essential for your body. The problem occurs when this cholesterol levels go beyond the normal range. That is when they put you at a higher risk of developing heart diseases. So the two most common type of cholesterols are LDL and HDL. LDL is usually termed as bad cholesterol and HDL is usually called good cholesterol. When LDL level go above the normal ranges, then the condition is termed as high cholesterol levels. Sadly, high cholesterol is like a silent killer and there are absolutely no symptoms associated with it. In many cases, if high cholesterol levels goes undetected, it can even lead to extreme situations like a stroke or a heart attack. The only way to know if you have high cholesterol levels is through regular checkup. The blood test will let us know the levels of lipid in your body. It is called as a lipid profile test, and this test is actually recommended for people above 20 years of age. You should get your cholesterol levels checked at regular intervals. High cholesterol levels is actually uncontrollable in some situations. Few of those situations are people who have a genetic predisposition and a history of high cholesterol levels, wherein high cholesterol levels run in the family. Women who have achieved menopause, they are at a high risk of developing bad cholesterol levels, which puts them at a higher risk of developing heart diseases. Men over the age of 45 and women over the age of 55, they tend to have a bad cholesterol profile and a greater risk of developing heart diseases. There are some controllable factors also, some controllable situations in which you can actually reverse your bad cholesterol profile to a good one. Firstly, the diabetic patients or the patients who have high blood pressure. Obese or overweight individuals, they can work on correcting their cholesterol profile. People who smoke or consume alcohol, they are also at a greater risk of developing bad cholesterol levels. And lastly, people with bad food habits and lack of physical exercise. This is also a very major factor contributing to a bad cholesterol profile. High cholesterol levels can be treated through various methods. The first one is, of course, medication to actually bring the cholesterol levels under the normal ranges. This will also eliminate the risk of developing complications associated with high cholesterol levels. The second thing is following a healthy lifestyle wherein you focus on a nutritious and a balanced diet, get in some physical activity in your routine, and try and cut down on the saturated fats and trans fat foods in your routine. The third way is adding more plant stenols and sterols, which will help in keeping the HDL levels normal, whereas reducing the LDL levels. By following simple tips and tricks, you can maintain normal cholesterol levels throughout your life. Starting with following a well-balanced and a nutritious diet which is low on animal fat as well as trans fats. Try and limit on the consumption of processed foods, sugary foods as well as foods that are high in trans fats. Include foods which are high in omega-3 fatty acids such as walnuts, flax seeds, sardines, trout and even salmon. Limit consumption of fried foods because that can increase your consumption of saturated fats as well as trans fats. Cut down on smoking and consumption of alcohol as that can be counterproductive. Try and maintain a regular exercise regime, especially including aerobic exercises for at least 3 to 4 times a week can be helpful. Try and achieve a healthy weight. And if you are recommended with any medications, make sure to take your medications regularly. Lastly, follow recommendations of regular checkups of cholesterol levels to see your progress.